So let's get started. The STEADI program begins with screening for increased fall risk by asking these simple questions. Have you fallen in the past year? Do you feel unsteady? Do you worry about falling? If a patient answers yes to any one question, that patient may be at increased risk of falling. To streamline operations, your staff can ask the 3 screening questions as part of the intake process. If a patient screens positive by answering yes to any question, the STEADI algorithm can help you determine the next steps. The algorithm is the core of the STEADI program. It is adapted from the recommendations of the American and British geriatric societies. Specific assessments are suggested to determine a patient's fall risk and appropriate interventions for each risk level. Patients who screen positive can be brought back in at a later date to complete the needed assessments and to discuss appropriate interventions. But the first step is to identify which patients might be at risk by screening your patients 65 and older.
So screening for falls was not something that our clinic did prior to beginning the STEADI project, and it was very important that we figured out a way that dovetailed with a lot of the other efforts that we were already doing in clinic. One of the ways that we started thinking about doing a fall screen on a routine basis was to add it to someone's chart, just like you would add an annual flu vaccine to someone's chart, so that it was triggering when that flu vaccine was due. In the same way, we developed a falls risk indicator so that when a fall screening was due for someone 65 and older, it would trigger on their chart and the provider and the other clinic staff would know that a fall screen was due.
We incorporated STEADI into our clinical workflow by first building it into the electronic health record. This alerts the nurse when the patient is due for screening, and then the nurse can ask the questions based right on the template in the electronic health record. If the patient is deemed to be at increased risk for falls by answering yes to any of the questions that would increase risk, then the nurse alerts the clinician to do the appropriate clinical assessment.